So my name is Dr. Ryan Sullivan. I'm a medical oncologist at Mass General Hospital Cancer Center. Had the pleasure today to speak at the Chabner Colloquium about our work in antigen presentation defects and as a mechanism of resistance to anti-PD-1 therapy in patients with melanoma. And then to be able to describe some of the techniques and strategies we're embarking upon to overcome that resistance. I think what's important to note is that across a number of different data sets, including our own MGH data set and data sets from other collaborators and other publicly available data, what seems clear is that antigen presentation, which is the process of proteins being presented on the outside of cancer cells, is a critical process that, when lost, in melanoma seems to be lost about 30% of the time, leads to decreased efficacy of anti-PD-1 antibody therapy. In our work, we've identified this as a key mechanism of resistance and are now embarking on strategies to overcome that. What I spoke about today were strategies to look at something called HDAC inhibition, which is a way of overcoming silencing of beta-2 microglobulin by epigenetic mechanisms. And the use of HDAC inhibition may actually allow for the waking up of antigen presentation on tumor cells and allowing the immune system to better clear those tumors. Another strategy I discussed was looking at combining a targeted therapy, in particular targeting a pathway called the MAP kinase pathway, which at least in a number of preclinical models and then also in patients who are receiving these therapies on their own, seems to increase antigen presentation, and in combination with anti-PD-1 antibodies or anti-PD-L1 antibodies seems to be, at least in small non-randomized studies, associated with improved outcomes. There is one randomized trial that was recently presented in Munich a couple weeks ago, which showed a trend towards an improving progression-free survival in patients who received 3 drugs: dabrafenib, trametinib, which are BRAF and MEK targeted therapy, plus an anti-PD-1 inhibitor called pembrolizumab, versus patients who had dabrafenib and trametinib. Importantly, that trial didn't meet its primary endpoint, but I think the data was interesting enough that we can build upon it and perhaps develop slightly different strategies to take advantages of the ways that those targeted therapies actually lead to changes in the tumor and the tumor environment, and in particular maybe increasing antigen expression and allowing the immune cells to better recognize and destroy the cancer cells. That's it for now from the Chabner Colloquium, and in regards to my presentation, it was really a pleasure to be here and really excited to continue to build on our stuff. Thanks.